Hey guys, welcome back to my channel. I'm Dr. Nevin Abraham, back with another episode of What If series. So today's topic is what if you don't get your cavities filled up? Yes, it's a very interesting and at the same time it's really important to understand what happens if you don't get your cavities filled up at different stages, because cavities के जो intensities है they are of different levels, like small, medium, large. So जितना small cavities है उतना बेहतर होता है to get them filled at a very early stage. And if you don't get them filled, what are the adverse effects of not following it, and what happens if you don't get them filled is what I'm going to discuss today. Now, when a patient comes for a routine dental checkup, now that's the initial stage where we can find if there is any issue that is happening onto the tooth surface, or if there is any decays or anything, etc., etc. So that's an initial stage where we can evaluate the oral hygiene for any patient who walks in for a routine dental checkup. Now, when they come, we evaluate their oral hygiene in a detailed aspect, like we check for presence of any cavity, as I told you earlier. We check for the gum conditions, दांत जैसे कि अभी कोई पेशेंट्स है जिनके दांतों पे ना डिपॉजिट्स होती है, जिसकी वजह से टूथ थोड़ा हिलते हैं. सो गम्स के जो कंडीशन है, जो टूथ के जो कंडीशन है, वो सब इवेलुएट करते हैं इन द फर्स्ट विजिट, लाइक व्हेन यू कम फॉर अ रूटीन डेंटल चेकअप. एंड ऑल्सो जो इन जनरल ओरल हाइजीन है, जैसे कि अभी जैसे मैंने मेरे पिछले वीडियो में मैंने बताया था, लाइक देर आर मेनी एट टाइम्स सम sharp tooth are there which goes unnoticed, which causes some traumatic injuries to the tissue, and वो एक precancerous lesions जैसा बन जाते हैं. So all these aspects are evaluated on your consultation for a routine general checkup. Now some patients during that particular visit, they give a typical complaint of food lodgement, जैसे कि खाना अटकता है दांतों के बीच में, sensitivity issues, जैसे झंझनाहट होती है, पेन होता है. So when a patient gives such complaints, all my viewers should understand, like अगर ऐसे कुछ complaints अगर आपको किसी दांतों पे अगर होता है, so you need to understand that it is a problem associated with a tooth or else a gum related issue. मतलब इधर टूथ में कैविटी हो सकती है या फिर गम्स के कुछ रिलेटेड इश्यूज है जिसकी वजह से ये कुछ प्रॉब्लम्स होता है. नाउ सम पेशेंट्स उनको दांतों में कैविटीज़ दिखती है, लाइक ब्लैक लाइंस होता है. सो दैट्स लाइक जो ब्लैक लाइंस जो दिखती है, that can be either stains or else a cavity. So that can be evaluated only if you come to a dental practice, you visit your dentist and get them evaluated. Now suppose what if that's a cavity. Now some patients, they don't develop any pain or any sensitivity issues. Now as I mentioned earlier in my previous videos, a tooth has got two layers before it reaches the heart of the tooth, that yani pulp. Now where the two layers is enamel, which is the most hardest, like the outermost and the hardest portion of the tooth, which doesn't contain any nerve fibers. So उसमें अगर कोई cavity होती है, so generally patients को sensitivity या फिर कुछ sensation, मतलब कुछ complaint होती नहीं है. So they are so surprised when we tell the patients that sir, ma'am, like you have got so and so cavities, like 3-4 cavities है. तो they are so surprised to hear that, because they're not having or they're not facing any issues with it. Now friends, let me tell you, cavities which are there at this stage, like which are in the enamel, they are the smallest, and they can be filled very easily without even giving anesthesia. मतलब इंजेक्शन बिना देके उस cavities को fill कर सकते हैं, और आपको एकदम least discomfort होंगे when we fill those such kind of cavities. Now even ऐसे जो cavities है, they are so much long lasting एंड इवन जो कॉस्ट होती है, आई मीन द लाइक फॉर एग्जाम्पल एक ऐसी छोटी फिलिंग XYZ अमाउंट लाइक से अबाउट 1,000 रुपीज़ अगर होते हैं, नाउ एज इट प्रोग्रेसेस इसका कॉस्ट बढ़ते रहता है. द रीज़न बिकॉज इसमें बहुत सारे मटेरियल्स यूज़ करना पड़ता है टू गेट देम फिल्ड. जैसे कि अभी जो वाइट कलर टूथ कलर्ड मटेरियल है वो डायरेक्टली डीप कैविटीज़ में नहीं डाल सकते बिकॉज दैट मे कॉज मोर इरिटेशन टू द सेंसिटिव टिश्यूज़ ऑफ द टूथ. सो जितना ज़्यादा मटेरियल्स उसमें डालना पड़ता है, लाइक अभी इन डीप कैविटीज़ एज आई टोल्ड यू, लाइक यू नीड टू पुट 2-3 materials to protect the underlying tooth structure. So उसके हिसाब से cost बढ़ती रहती है, like from 1,000 it may go up to 2,000 or 3,000 or maybe more. When such cavities, you know, they are ignored, like जो cavities which are there in the enamel, if they are not filled up at a very early stage, it progresses into the second layer which is the most sensitive layer of the tooth. उसको dentin बोलता है, DENTINE, dentin. So it's the most sensitive layer of the tooth, and most of the patients report to our office at this stage, which makes the restorative process more expensive compared to the basic ones. Because जैसे मैंने बताया था, एक टाइप ऑफ प्रोटेक्टिव मटेरियल, एक बायोकम्पैटिबल मटेरियल यूज़ करना पड़ता है इन द डीपेस्ट पोर्शन, जिसके वजह से ज़्यादा सेंसिटिविटी इश्यूज़ फर्दर न हो. सो उसके लिए एक एडेड मटेरियल डालना पड़ता है. नाउ पेशेंट्स इवन निगलेक्ट दिस स्टेज, मतलब कैविटीज़ जो इस स्टेज पे होती है तो भी पेशेंट्स निगलेक्ट करते हैं, ज़्यादा सीरियसली नहीं लेंगे, सहन करेंगे. और सहन मतलब अभी पेशेंट्स काफ़ी सारे ऐसे होते हैं कि जो 2 to 3 पेन किलर्स या ऐसा लेके उसको थोड़ा बहुत उसको सप्रेस कर देते हैं विदाउट अंडरस्टैंडिंग द सीरियसनेस ऑफ डूइंग इट. बिकॉज जैसा मैंने कहा था, ये स्टेज भी अगर जब क्रॉस होंगे, इट्स समथिंग मोर इन्वेजिव, दे विल गिव सम और द अदर एक्सक्यूजेस एंड दे विल स्किप ऑन टू द डेंटल विजिट्स until one fine day when they would, you know, get up with a terrible toothache giving them sleepless nights. And that's when all of you visit, or you know, not even visit, they'll remember the dentist, right? It's absolutely wrong. You shouldn't be doing that, because things which can be corrected at a very early stage should be corrected. The reason, as I told you, जितना जल्दी उसको ठीक करोगे उतना कम एक्सपेंस होगा और उतना लॉन्ग लास्टिंग होगा ट्रीटमेंट. नाउ when you experience a terrible pain, now the whole picture turns and there's a bad news. There's a change in treatment plan, and from a normal restoration you have got 2 options. You can either keep it or else you can remove it. If it's salvageable, most of the dentists, you know, they will try to save it by, there's only one procedure with which you can save it, and that's called as root canal. And उसके बारे में I'll be explaining in my upcoming videos. And so that's the most important thing which you need to understand, that you know about today's topic, that you should get your cavities filled, like irrespective of the number of cavities. If a dentist suggests you to fill it and emphasize more and more, you know, cavities अभी छोटी है, उसको जल्द से जल्द fill करो. Suppose if you do not have a budget of getting them filled altogether, there are some cavities which need to give more priorities. जैसे कि अभी कोई cavities है जो which are there in the second layer, so get them filled first. And बाकी के जो cavities है, you can, I mean, being a dentist, it's not at all advisable to tell you that, but फिर भी 1 month you can maximum wait. But my advice to you guys is that please don't delay it. So guys, it's a very humble request to all the viewers that if your dentist advises you to get the cavities filled up, irrespective of the number of cavities, please do get them treated at a very early stage and save a lot of money. Getting them treated at a very early stage is the best discount that you can give it to yourself, rather than bargaining with your dentist. Dentistry, becomes, as I told you earlier, I'm repeating it again and again, dentistry becomes expensive for you only because you neglect. So think. So that's it, guys, for today's topic on what if you don't get your cavities filled. I really hope you understood the content of this video. Please do support us by liking the video and subscribing to our channel. I'm Dr. Nevin Abraham signing off. Cheers.